Dr. Brad Hannon here with another one of my MET Foundations of Health videos, where I am teaching you how to move right, eat right, and think right. In this video, I'll be asking you a few deep questions to give you some perspective about health. Ask yourself, what is your number one asset? Hopefully you said your health, not your home, your car, or your boat. What do you base your health on? Most people base their health on how they look and how they feel. But the problem is, by the time you feel cancer, it is too late. By the time you feel cardiovascular disease, it is too late. The top 3 killers are cardiovascular disease, cancer, and medicine. So many times, by the time you look and feel ill, you already have a disease. Do you spray paint over the check engine light in your car when it lights up? No, of course not. So we need the right fix to correct the problem. We don't want to just cover up symptoms. Does taking drugs make you healthier or sicker? Does taking out organs make you healthier or sicker? Here's the problem. We know better how to take care of everything else in life besides our own body. Let me ask you, do you think that eating good, clean, organic food provides the fuel for health and healing? Do you think your emotions play a role in your health? Is your structure a part of your health? Great. Now you understand the philosophy behind chiropractic. As a chiropractor, we are educated in the health and healing without drugs or surgery by supporting the body's innate God-given ability to heal and want to thrive by addressing your structural health, emotional health, and nutritional health. Health is 100% function of the body, not just the absence of disease. What controls the function of the body? The brain and the nervous system. What protects the nervous system? Your skull and vertebrae. Studies show that misalignments or subluxations of the spinal vertebrae reduce communication of the nervous system. These misalignments can cause pain, numbness, headaches, and much more. Do you think it would be healthy to have your nervous system checked for impaired function due to subluxations? Certainly. I want to leave you with a few thoughts. What path are you on? There are 2 paths. One path leads to increased health, the other to increased risk of disease. So what are you going to do differently? When? When will you take action? Many people have good intentions, but few people take action and implementation steps necessary to stick the course and finish strong. How? How will you achieve your health goals? Who? Who will help you, guide you, and hold you accountable? The journey of health is a lifetime commitment, not just a destination. If you don't take action today, where will you be in 10 and 15 years? So when is the best time to start? Today. Remember, when you want to feel your best, think MET. How are you moving? How are you eating? And how are you thinking? And this can steer you in the right direction to achieve a healthier you.